Here to raise awareness of AFib and teach people what to do if they or their loved ones are at risk or concerned about the condition. Today, I have Dr. Tarakia, cardiologist and chief medical officer at iRhythm, and Melanie, AFib patient advocate and creator of National Atrial Fibrillation Awareness Month and founder of stopafib.org. Good morning to both of you.
Good
Good
morning.
morning.
Doctor, tell us, what is atrial fibrillation, AFib, and who is at risk?
Atrial fibrillation is an irregular and often very fast heart rhythm disorder. Some people are aware they're having AFib the minute they go into it. Their heart races, they feel palpitations or a fluttering heart. Some people feel short of breath or lightheaded, but often patients are unaware of AFib. They may get a little fatigued or winded, but it's natural to not think anything of it. Some may feel nothing at all, and it's really subtle at the early stages when AFib can come and go. But what we know is that anyone can develop AFib. And now the risk goes up with age, especially over age 65. But there's other contributing factors like high blood pressure, being overweight, diabetes, just to name a few. In the US, there's 3 to 6 million folks who have it, but there's 1.5 million who don't even know they have it, and that's why we're here today.
So, doctor, why is early detection of AFib so important, and what are the tools out there to help doctors diagnose AFib?
Well, it's important to understand that AFib can increase your risk of stroke and related heart problems, whether or not you're aware that it's there. It causes 1 out of 7 strokes, 1 in 3 can develop heart failure. And as you mentioned, AFib is readily treatable. The complications can be prevented, but you need a diagnosis to get there. And for that, you need an electrocardiogram or an ECG, an electrical photograph of your heart, to really capture that time you're in AFib. And it wasn't long ago that you had to come to my doctor's office or an emergency room to get a big, bulky machine connected to your chest with wires. But now these medical grade monitors come to you at your home and record your heart's electrical signal for up to 14 days. iRhythm Zio monitor, spelled is Zio. It's a patch, for example, you put on your chest, and it records up to 14 days while you go about your life. And that becomes really important to help your doctor make a diagnosis of AFib or other rhythm conditions, or give you the peace of mind that you don't have it.
Wow. Melanie, can you tell us about your experience with AFib and what inspired you to create AFib Awareness Month?
So AFib hijacked my life, and I was afraid to go anywhere by myself for fear that I'd have a stroke. So I had a procedure, and I've been AFib free for 19 years. But I didn't want other people to suffer like I had, so I started stopafib.org to help people living with AFib to get their lives back. And I also created AFib Awareness Month in order to raise awareness so we could get people diagnosed and treated before they have a stroke.
Now, Melanie, can you tell us more about stopafib.org and how you're helping others with the condition?
So I created stopafib.org as a patient-to-patient resource to share what I and other AFib patients have learned. We educate patients about how to manage and treat their AFib with our Get Started Learning About AFib guide, our newsletter with the latest AFib news, our discussion forum for getting peer support, and our video library for viewing recordings of our webinars, our master classes, and our annual 3-day AFib patient conference that features the world's top AFib experts. So get started learning about AFib at stopafib.org.
Melanie, I got to raise my hand to you and salute because you're always hearing about these innovations and startups with the younger crowd. And here we are. You know what I'm saying? Definitely. And doctor, it's really interesting that you've got the patch now versus the big machine. Medical innovation is hardly ever talked about. Why is that?
Well, innovation's happening in medicine all the time. And for me, that's why it's so exciting to both be a practicing physician and have the opportunity to help lead a company in that space that's trying to do great things. in this diagnostic space, there is going to be a trend of more and more coming into your house so you don't have to do it. Our Zio monitor does exactly that for heart rhythm conditions. And then the other side of this is the treatments have gotten so much better also with technology. So AFib is treatable. You can, be in a situation where it's ablated and you don't have recurrence. So lots going on, lots of exciting things, but the key message here is raising awareness that if you have these symptoms, we're not saying it's AFib, but have that conversation with your doctor. And if there is concern, they can help find the right tool.
I appreciate it. Dr. Tarakia, Melanie, thank you so much for joining us on Morning Blend. Again, my hats are off to both of you. Thank you so much.
Thank
Thank
you.
you.
Thank
Our
you for
pleasure.
sharing. Thanks.